I love core engaged bridging. So this is important that we understand why and how I do this. So the core engaged bridging becomes important for repatterning posterior chain movements. So we've all been told glute bridges are good, right? We need to perform glute bridges with our patients. The problem is most of us just do a regular glute bridge. So if he just does a bridge right here, yeah, that's fine. He may be working his glutes, he may not. He's a pretty good athlete, he knows his body well, he can do that, but most of our patients don't. So if you think about it, how many times have you done a glute bridge with somebody, they stand up, you're like, hey, how do you feel? And they're like, oh, my low back's kind of tight. Happens all the time because they're compensating. Their glutes aren't doing what they're supposed to do, so they're compensating with their extensors of their low back. So rather than it becoming a glute bridge, it becomes a lumbar bridge, which we don't want. So I never perform a bridge anymore if I don't have some sort of a core activation with it. Now there's a lot of different ways I can do that. The best that I've found for the post-op patient is to use a band or even like a suspension trainer. We're going to do it in a very safe environment for them, but we do need to start to get the nervous system turned on and get the core and the trunk stabilizers turned on. So the reason why we want to activate here is because reciprocal inhibition tells us that once I turn one muscle group on, the opposing muscle group turns off. It has to. The greater the contraction, the greater the relaxation. So if I can get his anterior abdominal muscles to come on, then the posterior, the lumbar extensors, can't come on. So then it becomes an actual glute bridge. What you'll find when you do these is people's bridges won't look as good. They won't go as high. And I'm okay with that because that's telling me I'm actually working on hip range of motion, not lumbar extension. So a couple different ways we can do this for the post-op patient. I've done it on a table here without a band, so I just bring them up here in front. What he's going to do is push his hands together. So he pushes hands together, and he's already getting some activation here. But the other thing he can do, lightly push into me. Good. As soon as he goes into any kind of pullover movement, this has to turn on. Relax for me. So for those of you who are always sitting here going, hey, squeeze here, tighten there, brace here, whatever those terms are, I'm going to make this really easy on you. Anytime you do this pullover movement, these stabilizers have to come on. So if we don't want to use a band, we want to keep them on the table, again, really safe position for them. He's going to push his hands together. Now I'm going to have him just lightly push into me. Automatically these are turned on. Now he can bridge. Good, and back down. And then relax. And what I want to do is I want to work sequencing here. So I want to tell this it has to turn on first before anything else happens. So push, lift, back down, relax. Push, lift, back down, relax. So this becomes a sequencing exercise. I turn this on first, then we bridge. Now if I want to use like some sort of a band, I can do that. I just have to set this up well. This becomes a little bit challenging in some clinical situations. So go ahead and grab those handles. Remember, he's still really limited on range of motion. So what you're going to do is you're going to straighten out your arms, but we're going to keep his range of motion right here. Okay? So really safe position here. So I'm just going to hold the band here. Now bring your arms down to the table. Good, right there. This is turned on. Now he bridges. And arms back up. Remember, we're just keeping it really safe, arms straight, really safe range of motion. We want to stay down here. Again, you need to work with whatever you're comfortable with and whatever your patient's comfortable with. Go ahead, arms down, bridge, and then back up. Let's go one more time. So the goal here is to keep them in a really safe environment, but start to repattern some of this proximal stability and these basic fundamental movement patterns.